Development Subcommittee made up of me and Netta within the AMENA Psy Student Committee. And AMENA Psy were the American Arab, Middle East, North African subgroup within psychology and within APA. And so we're hosting this today, and Dr. Khaddouma has graciously volunteered his time to help us learn about the board certification process. And I wanted to read the blurb we have for Dr. Khaddouma just to introduce him as our speaker today. So we have Dr. Alexander Khaddouma. He's a licensed psychologist and he's board certified in couple and family psychology. He's currently a staff psychologist and coordinator of outreach services at the University of Hawaii at Manoa. And he's going to be speaking tonight about the process and benefits of seeking board certification. And generally geared towards encouraging those of within the AMENA Psy community to, well, one, educate us on it, but two, encourage us to pursue it. But the information will be general for all people. So everyone is welcome for this recording tonight. And I can pass it over to you, Dr. Khaddouma.
Thank you, Emily. And it's really an honor to be here today. I'm really excited to give this talk within our professional community, especially for AMENA Psy, as this is, you know, an organization that's kind of close to my heart because of my own cultural background. I'm hoping to outline kind of the process and some of the benefits and reasons for seeking board certification. And, you know, I invite anybody, if you have questions throughout the talk, please feel free to contribute. I believe there's a chat where you can send in your questions, and I'll make sure to save some time at the end to address those questions. If you do have any that, you know, feel more pressing and you want to ask during the presentation, please feel free to, you know, either unmute yourself or raise your hand. I'll try and keep track of that. But I think I really thank the members of our student committee for putting together this talk among other professional development opportunities over recent months. I know a lot of work and coordination goes into these kind of events, and yeah, we're really grateful that you all are here to host them. Let me try and get my slides up, and I am happy to share any materials that I cover today with attendees. This is a recorded talk, so if you have any discomfort with you know, the recording, please feel free to rename yourself, or you know, you can turn your camera off if you'd like. Yeah, just feel free to take care of yourself during today's talk. And the recording will also be available to AMENA Psy members on the website afterwards. So if you are watching this talk at a later time and have any questions for me, I'll include my email address so you can reach out and let me know. But my name is Alexander Malik Khaddouma. I am board certified in couple and family psychology as of about a year ago. I am excited to talk about the process of board certification because it's something I've recently gone through myself, and you know, still can, you know, speak to some of the difficulties and positive aspects of the process. And then also I'm hoping to share this information with you in case it's relevant to your own professional development. And in our field, I think this is kind of a growing area of interest and importance for folks who are looking to provide psychological services in the future. So as I kind of give this talk, you know, one of the things I'll try and highlight is why it's an important process if you're interested in undertaking it yourself, and how it can benefit your own, you know, patient care and professional development in the future. So to start off with some brief introductions, you know, the AMENA Psy is an organization that, as I said, is kind of, you know, near to my heart, both because our previous president, Aisha, you know, went to my graduate school. We were colleagues, took a lot of classes together, and then also because of my own family's cultural background. On my father's side, I hail from Tunisia, specifically the town of Gafsa, which is kind of in the southern half of Tunisia. I know a lot of people here are probably already familiar with kind of the topography of North Africa, but the north side of Tunisia is beautiful. It's tropical. It's got beaches, lots of tourism from Europe and surrounding regions. The southern side is a little more like the Sahara Desert, a lot of Maghreb kind of topography, and really, really delicious food. So I'm a huge fan of the food from my homeland, and it's particularly harissa, which if you're ever looking for it in the US, Trader Joe's is the place to go. I can't ever find it where I'm located in Hawaii, so I try and stock up on it when I go home. I did my education in Knoxville, Tennessee, which is where my family was based during the many years that we were not going back and forth to Tunisia. I attended college at the University of Tennessee and then also graduate school. And then after graduate school, well, in Tennessee, I should say, is known also for its delicious food. We've got really good biscuits. The university is a great resource in the region. And then Dolly Parton. So we're known for a few notable things there too. Now I get to live in beautiful Honolulu, Hawaii, where I did an internship and then stayed on at the University of Hawaii at Manoa as a staff psychologist in our counseling center. I love living here. I love the local culture here. I'm still, learning a lot about myself and about this place. But over the past few years, it's really become home. And kind of because of this, varied background in several different locations, I find myself frequently traveling kind of halfway across the world if I need to visit my family in Tunisia. And then, as you can kind of see on this world map or partial world map, Tennessee is a nice halfway point between Honolulu and GAFSA. So a lot of times I'm kind of making multiple stops to see family in various places. It's kind of from this background that I originally became interested in couple and family psychology. So having come from an intercultural family, that also had, divorces and I have several siblings and, kind of a lot of dynamics in my upbringing that had to do with traveling between different locations and navigating cultural differences between my parents. I became very interested in working with couples and families and thinking from a systemic perspective in my clinical work and services as a psychologist. So it's kind of from my cultural background and family experiences that I became interested in the field that I chose to become board certified in. To give a kind of brief introduction to board certification in general, what do I mean when I'm using that term? The American Board of Professional Psychology is a umbrella organization that covers the various different specialties that as a future psychologist you can become certified in. So through this organization, which was started in 1947 as a partnership between the American Psychological Association and the Association of State and Provincial Psychology Boards, and that's the organization that actually grants licensure and coordinates different states' laws around licensure. That collaboration led to the American Board of Professional Psychology offering certification for specialists in different areas of our field. At the moment, there's 15 different specialty boards that you can become certified in as a specialist psychologist, and then one subspecialty board. And that's because we, under our neuropsychological board, we have a pediatric subspecialty. So I'll talk a little more about that. The purpose of this organization is to serve the public. And that's kind of an important piece because as psychologists, we are considered healthcare providers. And in the field of medicine, there's a pretty well-established process of becoming a board certified specialist in various areas of practical medicine. So for the purposes of the ABPP, the American Board of Professional Psychology, they ensure that we are serving the public by promoting the provision of quality mental health services. And they do this by coordinating the examination and certification process for professional psychologists who are saying they're engaging in a specialty practice. So they're either thinking a particular way in their work with clients and in their field, or they are engaged in using a particular kind of method or to provide interventions or work with people. So I'll give a little more clarity about that in a moment. But first, before we kind of begin this journey of thinking about the process of board certification, I encourage you to kind of take a moment and think about why you originally became interested in this field. Okay, and I recognize maybe not everybody is in the same kind of program or same or has the same career goals for the future. But for you individually, just take a moment to think about what originally brought you here. Why did you want to study psychology, if that's your field of study? Why did you decide within the field of psychology that you wanted to become a psychologist rather than enter, a different trajectory that you could use this degree in? And I think that's where kind of the first step of the board certification process actually begins, is just looking at yourself and figuring out what interests you and what kind of provider do you want to become in the future. For those who have not completed the internship process or, are still in graduate school at the moment, a lot of this will, I think, become clearer to you as you're, forced, for lack of a better word, to put down on paper your identity as a psychologist, as a person, as a professional at your current level of training. And for matching to an internship site, your essays will kind of require you to think a little bit about what brought you to the field in the first place. And that for me was an important moment, because for the first time, I really kind of had to put together my story of how my family experiences and my inner traveling between countries experiences growing up kind of contributed to my identity as a psychologist. And I had already, in graduate school, determined that I wanted to focus on couples and families. But the narrative of how I got there, I think, got a little more solidified as I began that process of matching to internship. To give you a sense of the spread of opportunities or areas of specialty you could pursue, as I said, there's 15 different specialties currently recognized by the ABPP. So each of these displayed on this slide are areas where you could potentially get board certified. And also, you can become board certified in multiple areas. So you might encounter professionals who are board certified in like both clinical psychology and in forensic psychology. And that can reflect sometimes just different stages of a person's career. One specialty area may be important for the work they're doing at a certain time, and then at a later time that shifts. And also that may reflect that people, work in a variety of capacities in their current job. So, you may be serving as a psychologist at the VA and an adjunct instructor, and, maintain some private practice hours where, you see a particular kind of client. So for that reason, you might see people who are board certified in multiple areas, but the majority are board certified in just one. Also, among these various boards displayed on the screen, there's certainly a disproportionate number of professionals seeking board certification in certain areas over others. So for instance, in couple and family psychology, in the whole United States, we only have about 100 people at currently board certified in couple and family psych. On the other end of the spectrum, we have, many more hundreds certified in clinical psychology or in counseling psychology. And those tend to be the two biggest areas of specialty for people. So a lot of people get their board certification in clinical psychology or counseling psychology. Another kind of growing area is in our school psychology. And then, as I said, there's a subspecialty area within clinical neuropsychology that is specific to people interested in pediatric neuropsychology. So before I kind of talk about the process of how you get to board certification, I want to, bring up a few of the benefits or reasons that you might even choose to pursue board certification in the first place. You know, I guess first is that you be distinguished as a specialist. So there is no other way in our field to get board certified. Okay, so there's a lot of ways you can pursue a particular expertise in a method. So for instance, you know, I could, with training, with supervision, with additional experience, I could become certified in, you know, emotionally focused therapy, or in, you know, offering a particular intervention or a family of interventions centered on a theoretical framework. But our board certification process in our field is the only way to be distinguished as a specialist in a particular way of thinking or a particular way of offering your services. There's also, you know, a monetary benefit for some folks to pursue board certification. And, you know, this really varies by setting. So for instance, where I am in a university setting, there's not necessarily a salary increase associated with board certification. But if you work for the Department of Defense or the VA system, or in certain public health service sectors, like at a hospital, then there can be a automatic pay increase upon your board certification. And in fact, at the VA, if you're either hired in, already board certified, or get board certified as you're working for the VA, they already have a system where you get a increasing salary over time each year. And that's specific to being board certified within, you know, in their system. And you don't have to get board certified in a particular subject area to qualify for that. So you could pursue, you know, the specialty that you're interested in, rather than, you know, kind of being told which area you needed to pursue to qualify. For those of us who, you know, might end up working in a hospital setting or in a medical setting, often those agencies will require board certification from their physicians. So sometimes there's an expectation that other providers also seek board certification if they're working with clients. So you may find that there's a, you know, extra set of expectations if you're a hospitalist, because your colleagues in the medical profession will be also expected to seek board certification in their fields. Hospital privileges are something that's becoming kind of less, I guess, less of a benefit or less systematically used by psychologists. But hospital privileges mean that you can admit patients to a local hospital that you're already approved by, and then you can actually see your patients while they're in the hospital. So you could, you know, then go conduct a session like in the morning or the evening with a patient who, you know, might have had an inpatient need because of a, you know, a psychiatric issue. And without board certification, sometimes you can't, it's more difficult to get approved to have those hospital privileges, which means you wouldn't be able to see your patient in that setting. Another really big one, especially for people who, you know, have their families spread out in various regions or travel a lot, licensure mobility is a lot easier if you're board certified. So when you actually go to fill out your licensure applications in various states, a lot of them will have a, you know, little section that says, are you board certified through the ABCFP? And, you know, if so, what's your board certification number? And that can really expedite you getting licensed in a neighboring state. And this can be important because if you know, relocate over the course of your professional career, or you know, choose to maintain a practice where you're seeing clients in one state while you're living in another, then that license mobility can become really important. And, you know, anything to speed up or expedite that process can become really important. Also, you know, if you are seeing patients who use their health insurance to see you, then a lot of times you can qualify for higher rates of reimbursement by the insurance provider. So you would, you know, literally be making more money, and wouldn't necessarily, and at the same time, your clients would be able to see you as a specialist. So you get referrals and connections with people who are looking for your expertise in your subject area. It's becoming more common for psychologists to get board certified. So that's kind of another just, general benefit. If you look through recent editions of the Psychology Monitor, which is, the APA publication, you'll see that more and more people they interview for those articles, the president of APA, a lot of those folks have that board certification in addition to their prior training. And then if you work in a university setting, board certification can facilitate the tenure and promotion. And that can be, and also I should mention, board certification is not just for people who are primarily seeing patients in their work as a psychologist. It also is a qualification that is totally appropriate for people in an academic setting or who might not be seeing clients at all, but maintain their licensure as a psychologist. And then lastly, you get access to a pretty tight network of other professionals specifically interested in your area of expertise when you get board certified. So it really opens up a lot of doors and allows you to meet a lot of people who just naturally share some of your interests and expertise. And it really facilitates being able to refer people to providers you know and trust with specialty in certain areas. So what I'll do is kind of try and, as clearly as possible, lay out the process of board certification so that it's no longer a mystery to you if you decide to pursue it in the future. What my kind of aim in putting together this part of the talk was to try and provide the information I wish had been given to me earlier in my training. I'm very grateful for the many trainings and professional development opportunities and mentorship I received during graduate school, but I do feel like I didn't get a clear sense of how you get board certified until after I was done with my graduate school training, after I got licensed and was ready to start applying. So hopefully this is a helpful preview of what's to come if you decide to follow this path. But the process of board certification is actually designed to really highlight skills that you have already developed by this point. By the time you go to apply for board certification, you're already required to have finished your graduate training, matched to an internship site, and have gotten your licensure in one of the states in the US. So you've already met all of the benchmarks up until the point that you're ready to apply for this certification. And at this point, really the focus is on you putting together a portfolio to highlight your skills or expertise in a certain area, rather than you having to seek further training, though sometimes that is necessary. So to give a basic layout of what happens, I'll talk about the application you submit initially, which is a generic application that everyone across all specialties submits first. Then you're reviewed for what they call a specialty credentials review, where your specialty area and the association associated with it looks over your materials and makes sure that you meet the specialty qualifications for your area of study. And then the more interactive part of this process becomes when you start putting together practice samples. So you are required to demonstrate evidence that you are practicing within this specialty, that you have expertise in delivering services or consultation in this area. And then once you've passed your practice sample, you take an oral exam. And again, by the time you get to the oral exam, you've already demonstrated in so many ways your skill and expertise in this area that the oral exam should be more of a collegial, friendly experience. So for those of you who might be in the midst of preparing for a dissertation defense or something like that, the oral exam has a different feel at this level of your training. You kind of go into it already feeling pretty confident, hopefully, and the people reviewing you are colleagues and as well as mentors sometimes, but I think it has a different feel than that evaluative experience of your dissertation. So step one, to how do you initiate the process of becoming board certified? My recommendation would be to start as early as you can in your professional career, just thinking about what kind of psychologist or provider you want to be in the future. So if you imagine, like, if you could have, any job or any kind of, schedule in the future for your work, what would it look like? What kind of activities would you be engaged in? If you're looking to, do a lot of clinical work, what kinds of patients and clients would you like to see in your practice? For me, I had a specific interest in couples therapy and also in research on romantic relationships. So I kind of came into graduate school already knowing that couple and family psychology was a big area of interest for me that I might want to pursue board certification. But without all of the experience in graduate school and afterwards and actually, getting supervision unique to couples therapy, seeking out family therapists who could provide me with kind of additional supervision and practicum experiences, then I would not have been ready to apply for board certification after licensure. It was through all of those steps kind of leading up to my application that allowed me to kind of think of myself as ready to try and get certified as a specialist. So some of the ways you can begin, I think, developing your identity as a specialist psychologist is by taking classes that interest you in your area. You can also seek out practicum experiences, either in your graduate program, or if you have a practicum coordinator, they might be able to help you connect with local providers who can provide some specialty supervision. Research is a major activity for a lot of folks in graduate school. So the kind of research you're engaged in also counts toward your developing identity as a specialist. Of course, if you're seeing clients, then seeking out supervision is both required, but also I think important if you're hoping to hone your skills in a certain area or work with particular groups that you might need to learn a little more about. And then also any advocacy or involvement in current issues outside of your graduate training specifically can be important in your development as a specialist as well. I think, I think especially speaking to other members of AMENA Psi, it can be really difficult to find, I think, culturally matched mentorship, especially for those of us who identify, in the AMENA community. But if you are seeking mentorship specifically within a particular area of board certification, you can use the ABPP directory and look up, all the board certified practitioners in your state of residence. And then you can, reach out and see if there's opportunities to connect with them or get guidance or perhaps even, consultation and supervision. So as you're kind of figuring out your path in your training and figuring out how to get experiences that fit with how you want to identify as a psychologist, another step that you can begin really early in your training is banking your credentials. And I'll say honestly, I think this is the part of the out of the whole process, this is the one I found to be the biggest pain. Just because I think as a graduate student, we're already used to tracking our clinical hours. We're, having to fill out our yearly APA review forms. So there's so many ways in which you're already probably really conscientious about tracking your activities. But when you get to the step of applying for board certification, they will require you to have banked your credentials through this central system called the Credentials Bank. And this is run actually through the Association of State and Provincial Psychology Boards. So this is the umbrella organization that unites all of the different licensing boards across the US, okay? So having your credentials banked in their system can be a pain in the butt to gather all that information, but kind of for the remainder of your professional career, you will be able to use this credentialing system to send documents to various licensing boards, to organizations that might request things like your transcripts or a copy of your diploma, all that stuff that's just a real pain in the butt to gather at a later time. The reason I really encourage folks to think about banking your credentials early is because it's free to start an account. So you can actually log in and begin this process, whenever you're ready. And then some of the documents that you'll need to gather are much easier to get while you're in the process of getting your training. So for instance, under your practicum experiences, like if you see on the right-hand side of the slide, there's a whole section to bank your hours that you spent getting supervision and providing clinical services during your different practicums in graduate school. And then what you do is after you enter those hours, you put in your supervisor's information and it forwards that information to them for them to approve. So without it being approved by that supervisor, you haven't technically finished the banking process. So, if you're several years out of graduate school, supervisors might be kind of hard to track down. There might be, unfortunate events like if a previous supervisor passes away. So early in your career, as you're actively getting supervision and tracking everything else in your professional life, I think this can be a really good time to go ahead and start the process of banking your credentials. Even if you never decide to pursue board certification, you can still use this system to apply for other things. So there's a particular program called the Certificate of Professional Qualification. So you might hear psychologists use the term CPQ. And that just means that a person has banked their credentials. They've had 5 years without any legal issues against their licensure. And once you're CPQ certified, which again, you don't have to do anything else other than banking your credentials and staying out of trouble for a while, then you can get easier licensure mobility when you apply to be licensed in multiple states. So again, even if you don't pursue ABPP board certification, banking your credentials can still be good for other activities that might involve licensure later. Another benefit of starting early is that it's cheaper to apply early in your career than after licensure. So there's various different ways to apply for start the board certification process. And this is just for the generic review. So before you're actually applying to your specialist board, you're just applying as a generic candidate. And if you look on the far left-hand side, this is probably the most relevant to a lot of the people here today. Our early career applicants get a discount. So your application fee is only $65 rather than $125 for regular applicants. If you're on postdoc or not yet licensed, but have finished your graduate training, the application fee is still discounted. If you're a training director and already serving in that function in your work setting, then it's a free application because they really want training directors to get board certified. And all you need at this stage is for this generic application is to be licensed, is to have your doctoral degree, and to have completed your internship. Okay, so for a lot of people, this might not be a step you're ready to take yet, but after you've made it through the whole circus that is getting licensed and qualified to practice, then the next step would be to just apply as a generic applicant for board certification. And what happens after that application is that the central office through ABPP will look over your application and just make sure you hit those 3 benchmarks, that you're licensed, have completed your internship, and that you have a doctoral degree. In a lot of states, you have to already, well, in all states, you already have to have your doctoral degree and internship completed to get licensed. So by the time you're at this point, you've already, probably met all of these qualifications. Then they'll forward your application to your specialty board. So each specialty has an association that kind of oversees specialist psychologists in their field of practice. So for me, it's the Association of Couple and Family Psychology. You know, if you're getting specialized in group psychology, then it would be the Association for Group Psychologists. But whatever that specialty review board is, they'll forward your application to committee members who will look over to make sure you meet the qualifications to identify with that specialty area. And so they may request additional materials. And the kinds of materials usually requested by the boards are evidence that you've done specialty practice. So that can be like unique rotations or hours during your internship that you spent, working in a particular capacity or with certain groups. Continuing education credits that you've gathered and in your field of expertise. Specialty coursework in this area, and also letters of support. So having a mentors or previously board certified specialists providing evidence that you've worked with them. Annette, I saw a raised hand. Did you have a question?
Yeah, there was someone who direct messaged asking, do you know if there are any specialty certifications for licensed master level psychologists?
Oh yeah, thank you for that question. To my knowledge, through ABPP, I don't know of any areas where you can meet the qualifications at the master's level. I think the requirement is having finished the doctoral degree, but that's specific to this kind of board certification. I couldn't speak to other areas where you could still be getting specialty certification, like through a certain modality or intervention. But yeah, thank you for that question, though. And then, another important part of the process is for some boards, for most boards, you'll be paired with a mentor in your specialty area who can kind of help lead you through the remainder of the process. So for me, I was paired with a couple and family psychologist who's practicing in New York City. Robin, she was so much help during my whole process because it was also taking place during the pandemic. So she really, helped me kind of figure out how I was going to put together my practice sample and how to prepare for the oral exam. So after you've gotten approved and submitted your paperwork and all of the documents that they require of you, you'll be invited to submit a practice sample. And the information on how to put together your practice sample is very clearly laid out in each of those specialty boards' individual websites. They're required to have a manual that tells you specifically what kinds of materials to submit, what are different options for the kind of practice sample you can put together. So this part of the process I found to be fairly clear. And then in addition, you have your mentor. So you're getting consultation regularly on how you can put together the proper materials and prepare for the next step. For two boards, for forensic psychology and clinical neuropsychology, they actually have an additional step before you can submit your practice sample, and that's a written exam. So that I can't speak to as much because I'm not, I haven't taken those exams or specialized in those areas, but they do have a written exam before you can proceed to this step for two boards. What's included in your practice sample is usually a professional statement, which kind of outlines your identity as a psychologist, why you're seeking certification in that area. And then you provide examples of your work that demonstrate your competency in the specialty area. So for me, that included a digital recording, and that could either be of your work with a particular client or clients, or you can also submit practice samples in other areas of your functioning as a psychologist. So I actually submitted a teaching sample rather than a clinical sample because we were just beginning the pandemic at that time and changing to telehealth, and it kind of messed up my my plan to record a session with a couple I was working with. So I ended up providing a training opportunity for as part of our internship program. And that was what I used as my practice sample. The board will usually ask for some supporting materials in addition to whatever kind of recording you provide. And that can include things like your case notes. If you do an assessment sample, then you might submit some of the testing materials or assessment report. If you collect treatment outcome data, then you can provide that. If it's a different kind of sample like mine, you can provide your presentation materials like your slides or any readings you required. And then you can offer like any other contextual or supplemental information to explain the context around the sample you're submitting. Okay, so you're really taking time to kind of build a portfolio that demonstrates your work in this subject area. And then you'll have a committee review that practice sample. And this will be the same committee for most boards that will then provide your oral exam. Okay, so a lot of times, in most cases, the people that you end up meeting either face-to-face or over Zoom for your oral exam are people who have already read all your materials, they've seen your application, you've written this lovely professional statement, you've provided a lot of evidence of your specialty practice in this area, so that they already kind of know you. And again, at this point in your training, you're already functioning as a psychologist in your own right. And these are colleagues that are talking with you about your identity and experience in the field. So I think it carries a slightly different tone than like your dissertation defense, because you're really not defending your practice sample. You're just demonstrating your knowledge of it and kind of verifying that you meet the different foundational and functional competencies in this area. So usually the oral exam is about 3 to 4 hours long. They're held throughout the year with time and location based on your agreement with your specialty board. So actually, mine was over Zoom because it took place during the pandemic. Prior to that, a lot of people took their oral exam at the APA conference and arranged for a chunk of time where they would meet with their committee members. Usually you have 3 committee members, and 1 committee member will serve as the chair, who kind of organizes the oral exam, explains the structure, and facilitates some of the conversation. And usually the focus of the exam is just direct questions about your professional statement, about your practice sample, and then they'll have a checklist and evaluation form that they're completing that is meant to kind of demonstrate that you meet certain foundational and functional competencies, and then also that you demonstrate competency within your specific specialty area. So for me, there was questions that were unique to systemic thinking in treatment with couples and families, ethical issues that might come up in the context of couple and family therapy specifically. So again, it's not something that I think that has to carry a lot of stress behind it, because again, by the time you've gotten to the point of your oral exam, you should be pretty well prepared for those kind of questions, and it's more of a collegial meeting. By foundational competencies, usually what the board is looking for is demonstration of your skill in handling ethical issues, that you can self-assess and care for yourself as a professional, a foundational understanding of our scientific body of knowledge and methods, evidence-based practice, interdisciplinary systems. So these are some of the things that actually, are carried over from your training in previous years if you're part of an APA approved program or internship site. So a lot of these things really map onto competencies you've already gathered or gotten experience in previously. Then functional competencies have to do with you actually using that body of knowledge in a applied way. So, your skill in assessment and intervention and consultation, teaching, providing supervision. So it's kind of using that body of knowledge to actually put it into practice. And these are both areas that are being assessed during your oral exam. Hopefully, after you've successfully defended your oral exam or taken your oral exam, there's not, as I said, there's not defending anything. Then you get congratulated by the board. You get a nice email from the president of your specialty area that welcomes you into the association. You get a little diploma you can hang on your wall. And then you also get put into the directory of all board certified specialists in the United States. And people then can look you up or look for specialists in their area, and your name will come up. So this is kind of a, even though the ABPP has been around since 1947, a lot of the specialty areas are still quite small in the grand scheme of things. So I think currently there's only 2 of us who are board certified in couple and family psychology in the whole state of Hawaii. So one thing I kind of noticed after getting board certified was that you do start to notice people reaching out because they have, either inquiries or seeking consultation, or they get referred to you with a question that's unique to your specialty area. So, being included in this network and considered a specialist does get you a lot of inquiries and networking opportunities afterwards. So I want to save some time here at the end to see if anybody has any questions. And like I said previously, if we don't have time or you're uncomfortable asking any particular questions right now, please feel free to email me at the email on the screen. And I'm always happy to touch base that way. But I guess I'll open it up to our moderators if there's any questions that have come up.
Emily, did you? Oh, yeah, there you go.
Thanks so much, Dr. Khaddouma. I was trying to scan to see if questions had come up in the chat throughout.